What exactly is gonorrhea? Gonorrhea is a common sexually transmitted infection caused by the bacteria. This bacterium can infect various moist, warm areas of the body like the urethra, rectum, throat, and in women, the cervix. It's primarily spread through sexual contact, including vaginal, anal, or oral sex. An infected person might not show any symptoms but can still pass the bacteria on to their sexual partners. Many people, especially men, might notice symptoms like a burning sensation during urination or a discharge from the penis. Women might experience vaginal discharge, pain during urination, or bleeding between periods. However, a significant number of individuals, particularly women, may have no noticeable symptoms. This silent nature of the infection means it can go undiagnosed and untreated, leading to more serious health complications. So, to recap, gonorrhea is a bacterial STI passed through sexual contact and can be asymptomatic. This basic understanding is vital because it sets the stage for discussing why, even after treatment, gonorrhea can sometimes reappear. Knowing your enemy is half the battle, as they say in medicine too. Now let's talk about why infections like gonorrhea can sometimes recur. When you get treated for gonorrhea, typically with antibiotics, the goal is to kill all of these invading bacteria. However, a few different scenarios can lead to the infection returning. One primary reason for recurrence is reinfection. This often happens if a sexual partner you had before treatment was not also treated, or if you have new sexual contact with someone who is infected. The antibiotics cleared your system, but they don't provide a shield against future exposures. Another possibility is treatment failure, which can occur if the bacteria causing your infection are resistant to the specific antibiotic used for treatment. Antibiotic resistance is a growing concern worldwide. If the antibiotics don't fully eradicate the bacteria, the remaining ones can multiply, leading to a return of symptoms and the infection. Not completing the full course of antibiotics as prescribed can also lead to problems. If you start feeling better and stop taking your medication early, some bacteria might survive. These survivors can then regroup and cause the infection to flare up again. Completing your antibiotic course is crucial for ensuring all the harmful bacteria are eliminated. Understanding these mechanisms is key to preventing recurrence. Let's delve deeper into reinfection, as it's the most frequent reason people experience gonorrhea again after successful treatment. When your doctor treats you for gonorrhea, the antibiotics work to eliminate the bacteria from your system. However, this medical victory doesn't grant you immunity. You are just as susceptible to contracting gonorrhea again if you are re-exposed to the bacteria. The most common scenario for reinfection involves sexual partners. If you have sex with a partner who has untreated gonorrhea, you can easily get infected again. This is why it's critical that all of your recent sexual partners are also tested and treated for gonorrhea, even if they don't have any symptoms. Abstain from sexual activity until both you and your partners have completed the full course of treatment. Typically, doctors advise waiting at least 7 days after finishing all medications before engaging in sexual activity again. Ensuring all partners are treated remains a cornerstone of preventing reinfection. Sometimes the issue of gonorrhea recurrence stems from the initial treatment itself not being fully effective. This is what we call treatment failure. When treatment fails, it means the antibiotics prescribed did not completely eradicate the bacteria from your body. A primary cause of treatment failure is antibiotic resistance. Bacteria, including the ones that cause gonorrhea, can evolve and develop ways to survive the effects of antibiotics. If you are infected with a strain of gonorrhea that is resistant to the particular antibiotic you were given, that drug simply won't be effective. Another factor that can contribute to treatment not working as expected is not taking the medication exactly as prescribed. If symptoms persist or return shortly after completing treatment and you are certain you haven't been reinfected, it's crucial to see your doctor again. They may need to perform further tests and prescribe a different or more intensive treatment. Recognizing the red flags. Symptoms of recurrent gonorrhea. If gonorrhea does return, you might experience symptoms similar to your initial infection. For men, common signs can include a renewed burning sensation or pain when urinating. You might also notice a new or changed discharge from the penis. For women, the symptoms of recurrent gonorrhea can also mirror a primary infection. These might include an unusual increase or change in vaginal discharge, pain during urination, or bleeding between periods. It's important to pay attention to your body and any new or returning discomfort. It's crucial to remember that a recurrent infection can also be asymptomatic. If you've been treated for gonorrhea and you start to notice any of these symptoms again, seek medical attention promptly. Prompt medical attention is key. The doctor's detective work. Diagnosing a return case of gonorrhea. When you go to your doctor with concerns about recurrent gonorrhea, they will need to perform some diagnostic tests to confirm if the infection is indeed present again. The process is generally similar to how an initial gonorrhea infection is diagnosed. Your doctor will start by asking you questions about your symptoms, your sexual history since your last treatment, and whether your previous partners were treated. The most common way to test for gonorrhea involves taking a sample from the potentially infected site. For men, this often means a urine sample. For women, a swab is usually taken from the cervix during a pelvic exam. If you've had oral or anal sex, swabs may also be taken from your throat or rectum. These samples are then sent to a laboratory for analysis. If gonorrhea is confirmed again, your doctor will discuss the next steps, which will likely involve another course of antibiotics. Smart steps to stop recurrence. Your prevention toolkit for gonorrhea. Preventing gonorrhea from coming back is largely about taking proactive and consistent steps to protect your sexual health. One of the most effective strategies is the consistent and correct use of condoms every time you have vaginal, anal, or oral sex. Condoms act as a physical barrier, significantly reducing the risk of bacteria being transmitted between partners. Another critical step is ensuring that all of your sexual partners are tested and treated. Open communication with your partners about STI testing and treatment is essential. Regular STI screenings are also a smart move, especially if you have new partners or multiple partners. Early detection of any new infection means early treatment, which can prevent complications and stop you from unknowingly passing it on. Always complete the full course of antibiotics prescribed by your doctor. Following medical advice carefully is a fundamental part of ensuring the treatment is successful and preventing a return of the infection. Partner power. The crucial role of treating everyone involved. If you are diagnosed with gonorrhea, it is essential that you inform anyone you've had sexual contact with recently. These individuals need to be tested and, if necessary, treated for gonorrhea, regardless of whether they are experiencing any symptoms themselves. If your partners are not treated, they can continue to carry and transmit the bacteria. This means they can reinfect you as soon as you resume sexual activity, or they can pass it on to others. Abstaining from sexual contact until treatment is complete for everyone is a non-negotiable part of this process. Complete means finishing all prescribed medication and waiting the recommended period afterwards, usually 7 days. Resuming sexual activity prematurely is one of the surest ways to get reinfected. Having this conversation is an act of care and responsibility. Ensuring all partners are treated is not just about preventing your own recurrence, it's about safeguarding the health of your sexual network and the wider community. Your health journey. Staying vigilant and seeking ongoing support. Managing your sexual health is an ongoing journey, not a one-time fix. After you've been treated for gonorrhea, it's wise to remain vigilant. Pay attention to your body. If you notice any symptoms that are similar to your previous infection, seek medical advice promptly. Consider incorporating regular STI checkups into your routine healthcare. These checkups can help detect infections like gonorrhea, even when they're not causing any symptoms. If you do experience recurrent gonorrhea, talk to your healthcare provider about your concerns. By practicing safe sex, ensuring partners are treated, completing your medication, and maintaining open communication with your doctor and partners, you significantly reduce your risk. Stay informed, stay vigilant, and always reach out for professional medical help when you need it.